What is osteoarthritis? Osteoarthritis is a degenerative joint disease that occurs when the cartilage that cushions the ends of the bones wears down over time. This condition often affects joints in the hands, knees, hips, and spine. As the cartilage deteriorates, bones may rub against each other, leading to pain, swelling, and decreased mobility. Causes of osteoarthritis. Osteoarthritis develops due to the gradual breakdown of cartilage in the joints. The main causes include 1. Aging. The risk increases with age as a body's ability to repair cartilage diminishes. 2. Joint injuries. Previous joint injuries, such as fractures or ligament tears, can lead to osteoarthritis later. 3. Repetitive stress. Occupations or activities that involve repetitive stress on joints can wear down cartilage over time. Obesity. Excess body weight increases stress on weight-bearing joints like the knees and hips. 4. Genetics. Some individuals may inherit a tendency to develop osteoarthritis. 5. Other diseases. Conditions such as diabetes or inflammatory arthritis can increase the risk. Symptoms of osteoarthritis. 1. Pain. Pain in the affected joints, especially after movement or prolonged activity. 2. Stiffness. Stiffness in the joint after periods of inactivity or when waking up. 3. Swelling. Mild swelling or tenderness in the joint. For a reduced range of motion, the affected joint may not move as freely as it used to. 5. Grating sensation. Feeling or hearing a grating sound when the joint moves. 6. Bone spurs. Extra bits of bone that form around the affected joint, which can contribute to discomfort and restricted movement. Diagnosis. Peripheral joint OA may be diagnosed confidently on clinical grounds alone if the following are present. Persistent usage-related joint pain in one or a few joints. Age is greater than or equal to 45 years. Morning stiffness is less than or equal to 30-minute test. Presence of other clinical features of OA adds to the diagnostic certainty. This approach to a clinical diagnosis is supported by the fact that radiographically assessed, structural changes may be present in the absence of symptoms and vice versa. Additional testing in selected patients. Appropriate imaging and laboratory investigations are reserved for patients presenting with atypical symptoms and signs such as an unusual site of involvement, symptoms and signs of joint inflammation, marked rest and/or night pain, and rapidly progressive pain. Differential diagnosis. The differential diagnosis for OA depends largely on the location of the affected site as well as the presence of absence of additional systemic symptoms. The differential diagnosis includes rheumatoid arthritis, psoriatic arthritis, crystalline arthritis, gout or calcium pyrophosphate crystal deposition disease, hemochromatosis, infectious arthritis, and other soft tissue abnormalities. Treatment options for osteoarthritis. Osteoarthritis treatment focuses on managing symptoms, improving joint function, and slowing the progression of the disease. There is no cure, but medications, lifestyle changes, and in some cases, surgery, can help manage the condition. Drugs used to treat OA. 1. Analgesics, pain relievers. These medications primarily reduce pain but do not treat inflammation. Acetaminophen, Tylenol. Often the first-line treatment for mild to moderate pain. It is less likely to cause stomach problems than non-steroidal anti-inflammatory drugs, NSAID, but it may not be as effective for more severe pain. 2. Non-steroidal anti-inflammatory drugs, NSAIDs. NSAIDs are commonly used to relieve both pain and inflammation. They can be taken orally or applied topically. Ibuprofen, Advil, Motrin, reduces pain and inflammation. It's commonly used for mild to moderate OA. Naproxen, Alevi, Naprusen. Another oral NSAID with longer-lasting effects than ibuprofen. Diclofenac, Voltaren. Available as a gel that can be applied directly to the skin over the joint, reducing pain without systemic side effects like gastrointestinal issues. Celecoxib, a COX-2 inhibitor that specifically targets inflammation with less risk of stomach ulcers than traditional NSAID. 3. Corticosteroids. Dosti are powerful anti-inflammatory drugs that can be injected directly into the affected joint to reduce inflammation and pain. Intra-articular corticosteroid injections. These provide relief for weeks to months, but are generally used sparingly because frequent injections can weaken the joint. 4. Hyaluronic acid is a substance naturally found in joint fluid that helps lubricate the joint. Hyaluronic acid injections. These are used to supplement the natural joint fluid, improving lubrication and possibly reducing pain. They are typically used for knee osteoarthritis and can provide relief for up to 6 months in some patients. 5. Opioids for severe osteoarthritis pain that doesn't respond to other treatments. Doctors may prescribe opioids. However, these are used cautiously due to the risk of addiction and other side effects. Tramadol, a weaker opioid sometimes prescribed for moderate to severe pain. Hydrocodone or oxycodone, stronger opioids for more intense pain, used only when other treatments fail. 6. Duloxetine Cymbalta. This is a serotonin norepinephrine reuptake inhibitor (SNR), typically used for depression and anxiety, but has also been approved to treat chronic musculoskeletal pain, including osteoarthritis. It can help with both pain relief and improving function. 7. Supplements, and people use dietary supplements in hopes of improving joint health and relieving pain. However, the effectiveness of these supplements is still debated. Glucosamine and these are commonly taken to improve joint health and reduce pain, although studies on their efficacy have produced mixed results. 8. Topical agents. These are applied to the skin over the joint to relieve pain. Capsaicin cream. Made from chili peppers, it reduces pain by blocking pain signals in the nerves. Lidocaine patches. These provide localized pain relief without the systemic side effects of oral medications. Non-drug therapy. In addition to medications, non-drug treatments can help manage osteoarthritis. Symptoms. Physical therapy. Strengthening the muscles around the affected joint can reduce stress on the joint and improve mobility. Exercise. Low-impact exercises like swimming, walking, or cycling help maintain joint function without worsening symptoms. Weight management. Losing weight reduces the stress on weight-bearing joints. Assistive devices, braces, shoe inserts or canes can help take the pressure off affected joints. Hot and cold therapy. Applying heat or ice can help alleviate pain and inflammation temporarily. Surgical option. When medications and lifestyle changes are insufficient, surgery may be considered for advanced osteoarthritis. Arthroscopy, a minimally invasive surgery to remove loose cartilage or repair damage in the joint. Joint replacement arthroplasty in severe cases, especially in the knee or hip. The damaged joint may be replaced with an artificial one. Osteotomy. Bone is cut and realigned to reduce pressure on the affected joint. By managing osteoarthritis through a combination of medication, physical therapy, and lifestyle adjustments, many individuals can live active, fulfilling lives despite the condition.